As we continue to look at the ethics of distribution, one of the things that we need to identify is the goals of healthcare and what is it that we are distributing. So, your book claims that disease is somewhat difficult to define. It gives the following definition: any deficit in the physical form or physiological or psychological functioning of the individual in terms of what society wants from or what society wants or expects from that individual, or in terms of what the individual wants or expects for himself or herself. And again, we can see that there's a lot of disparity as we get into particulars. So the goal of healthcare, even if we have some disagreement in defining disease in a philosophical sense, um, is that we want to create a fair system in which society's power can be used to treat disease and to do the best we can in trying to respond to individual and society's definition um, of disease. So in philosophy, there is sometimes a distinction and in ethics made between instrumental and intrinsic goods. So I want to take a moment just to talk about that, and then we're going to look at some possible healthcare goals or what can get called intrinsic goods. An instrumental good is commonly defined as a means towards some other intrinsic good. In other words, it's not always good for its own sake, but only good insofar that it provides utility towards that end. So an example that's often given is a dollar bill. While most of us would want it, we recognize that at basic value it's green paper. But because there's an agreed upon purpose to that green paper and it has a particular value in our social context, then that dollar bill can be used towards other goods. And your book mentions that the healthcare and the healthcare system is really an instrumental good. It's not a good in and of itself. Um, so let's look at what instrumental goods are aiming towards. They're aiming towards intrinsic goods, which have value within itself. It's good for its own sake, and it does not need any further context to have value. So some examples of intrinsic good might include health or happiness or freedom or autonomy. So let's see if we can try to identify these particular goals or intrinsic goods. So three possible goals are mentioned in this chapter as kind of inherently intrinsically good: the prolongation of life, the alleviation of suffering, or the optimizing of a patient's chance for a happy and productive life as defined by the patient. And let's take a look at these three, and then we're going to see in the final slide and in this lecture maybe some qualifications around them. So prolonging life. Our society expects medicine to help us avoid or indefinitely postpone death. And because of that, we start to raise the question, if simply prolonging life always leading to unnecessary suffering and cost? Is this really an intrinsic good to just try to push the continuation of life forward? And we're going to talk a bit about costs in the next few lectures, but a quarter of all Medicare funds are spent in the last year of a person's life. And so while long life can certainly be seen as something valued in and of its own sake, it does have limits. And we have to ask, is that always the best use of money and resources towards the end of life? Alleviating suffering. Again, most of us would agree that this would be an intrinsic good. And while we might say that we should eliminate unnecessary suffering, we have to be careful that just eliminating suffering is not simply treating the conditions, treating the manifestation of an illness and not getting at the conditions and causes underneath. So suffering and pain tells us that something is wrong. And so while we don't want patients to suffer, we also want to use that as an indicator to try to figure out what is the source of the disease or problem. And so some will say that we overprescribe painkillers or other things that are really not treating the problem, but simply eliminating suffering. And the last one, the productive and happy life as defined by the patient, is certainly in alignment with our commitments to patient dignity and autonomy. But we can see that this is pretty complex in our society. And just taking the example of mental health can show some of the necessary resources that society would need to meet all of those individual demands. So we're going to have to practically look at social and individual constraints on ideas of happiness and on notions of productivity. So given that there's a limit that's just intrinsic to the healthcare system, based not only on medical limits of medical knowledge, but also limited resources and things like that, we can certainly set a goal of humane healthcare. And here's where some minimum level of treatment around some of those intrinsic goods can be spelled out. So, suffering. The individual can gain relief from debilitating pain. Um, the individual can be restored at least to the minimum ability to function and valued by society. We talked about the prolongation of life. The individual can be spared a death that is the result of trivial or avoidable circumstances. The individual's sense of happiness in larger society. This can be helped by the individual being spared disfigurement that might make him or her repugnant to society and himself or herself. And the individual be spared a loss of function that will make him or her unable to share the actions, burdens, and accomplishments that members of society demand. So while we started out with some limitations on those general principles, as we think about more specific applications, we can see that there's some wisdom there.